We have for sure seen increased volumes of patients.
Grand Rapids emergency rooms and med centers see near record numbers of patients worried about the flu. And the people who run those emergency rooms are offering the same advice to most people who think they may have influenza. Think before you come in. A live look now outside Spectrum Butterworth's emergency room in downtown Grand Rapids. 24-hour News 8's Joe LaFergie is there right now. Joe?
Yeah, Susie, as a matter of fact, things have calmed down from what they're telling me here in the ER from earlier this week, Monday and Tuesday, where record patient volumes were experienced, all because of the flu. All the same story at the other Grand Rapids metropolitan area hospitals, H1N1, influenza in general, causing quite a bit of stress on local ERs. Michelle Aronson had gotten to know the halls of Metro Health Hospital pretty well over the past few days. Her 5- and 13-year-old sons were here earlier this week, sent here by their family doctor. Her grandfather's here now. The boys are now recovering at home.
It's just a madhouse. My kids go to Wayland, and they've had over 60 kids out in the last 3 days.
Confidentiality rules keep us from showing you pictures of patients crowding ER waiting rooms, but the mask supply at the admittance desk and the behind-the-scenes hustle, doctors and nurses going from patient to patient, gives you a better idea of just how busy the flu is keeping them.
We do see some patients that will come in and they will require some treatment, some supportive care, and then we also do have some people that come in that are worried about having the flu.
And Metro's not alone.
It's been quite busy, but we're getting through it.
At Spectrum Butterworth, they're seeing a record number of patients worried about the bug. It's the same story at St. Mary's, where Monday and Tuesday were the busiest days so far this week. And the people who run those emergency rooms are offering the same advice to most people who think they may have the flu. Think twice before you come in.
If you have shortness of breath, or feeling very weak and not able to keep fluids down, those are certainly reasons we would want to have you seek medical care in the emergency department.
Otherwise, most people should be able to stay home and ride it out. Along with putting a strain on local ERs, the flu has presented yet another challenge, trying to keep the ERs from becoming a conduit for spreading the bug.
If you come in and you don't have H1N1 flu, you certainly can get exposed to it in the emergency department. We try to mask people who have it, or even people who don't have it will wear masks to protect themselves.
And the Centers for Disease Control and Prevention have put out guidelines for the general public for H1N1 and all the different forms of influenza. And they talk about things like recovery time, the symptoms, and when to seek more additional medical help. We, of course, have a link to the CDC's website on our website, woodtv.com. Back to you.
Thank you, Joe.